Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us here on Health Professional Radio once again. In this segment, we're going to be speaking with Dr. Randeep Suneja. He's joining us here as one of a very few quintuple-board certified cardiologists in the United States, and he's been in private practice in the Houston area since 1993. He's also the founder of the Cardiology Center of Houston. Welcome to Health Professional Radio, Dr. Suneja. Thank you for joining us this evening.
Thank you, Neil.
It's my understanding that you're joining us here this evening to talk about your experiences with prescribing Leqvio. Is that correct?
That is correct, yeah. I've been very fortunate that I was one of the very early prescribers of Leqvio. I've been using it for the last 6 months or so.
What is it indicated for specifically?
So Leqvio is a drug which has been indicated for a reduction in LDL for patients either they have heterozygous hyperlipidemia, familial hyperlipidemia, or in patients who have atherosclerotic coronary artery disease in which we are unable to achieve the targeted LDL. Mm-hmm. So in these two group of patients, it's indicated.
Was there a serious unmet need in these two patient populations? Is that the reason that you started prescribing Leqvio, or was there something else that prompted you to begin prescribing it to your patients?
I think there is definitely an unmet need. I have used, obviously, as you know, I have been prescribing, I've been in practice for over 3 decades now, and used all the drugs, including statins and other PCSK9 inhibitors. But we had patients who were unable to achieve the targets with those drugs or have had reactions to those drugs. So in those patients, Leqvio has been a great asset as it can be used as essentially given 2 injections, sub-Q injections over 1 year. Although in the first year, we do have to administer 3 injections. First 2 injections are 3 months apart. And my experience has been very positive.
Now, you did mention that it is ideal for those who have suffered reactions from other therapies. Does Leqvio have any side effects of its own?
No, I have in my clinical experience. I think local reaction is one of the side effects that patients do experience, but this has been in at least the patients that I have utilized, the reactions have been very, very almost negligible to none. Yeah.
And what have your experiences been using AICs for prescribing Leqvio?
Fortunately, we have had great experiences. We've had patients who've been able to get their injections in the alternate injection centers with rather ease. We do have a very great team that helps us, and then we are working with these centers in Houston. We've used in almost 3 centers where patients have been able to get these drugs with a fair amount of ease, But you do have to have very good documentation in your charts where patients, where you are indicating this drug and you're giving the drug with proper documentation so that it makes it easy for the centers to get all the insurance approvals. But we've had great success in the majority of the patients.
What have you heard among your colleagues concerning prescribing Leqvio? Have any of them been a bit hesitant? And if so, what was their reasoning?
Well, like any other new drug, physicians are always concerned. But I was, we had Dr. Eugene Braunwald, who is the grandfather and father of cardiology, who's a professor at Harvard Medical School. He gave a grand rounds here at Methodist DeBakey in spring of this year, and I was fortunate to attend the grand rounds. And his talk about Leqvio, that how this is truly almost a paradigm shift in management of hyperlipidemia in patients, and he showed all the slides that how administering this drug, because of the fact that, you basically take a couple of injections a year, although in the first year, you will require 3 injections. It increases the compliance. The effectiveness of the drug is phenomenal. We have clearly easily 50% reduction in the LDL, in addition to all the additional therapies, because most of these patients are already taking statin drugs. and they're not achieving their LDLs. And if we add this drug with just a simple 2 injections a year, we can have additional 50% reduction in LDL, which really is phenomenal because it brings down to the target LDL that we are all achieving. Under normal practice, only 70 to 75% of patients are not achieving targets. So, and recently, in fact, about 2 weeks ago, the American Heart Association and American College of Cardiology have reduced the LDL target to 55 now. Previously, it used to be 70. So when it was 70 to 75% of patients were not achieving the LDL targets. And we know that low LDLs are the best for the patients. And now we have to bring the LDL to below 55. We have to have effective drugs. And if we can accomplish that with a drug like Leqvio, I think it is phenomenal. And my personal experience has been excellent. We've had about easily 50% to 55%, even 60% reduction in the LDL.
Other than patients who have experienced adverse reactions from other therapies, what other characteristics would you say describe a perfect candidate for Leqvio?
So patients, as we talked, that majority, 75-80% of the patients are not achieving their LDLs. So if we can, or if they have had side effects with statins, so we use the word maximally tolerated statins because patients do experience adverse effect with statins. But if they are not achieving the LDLs with maximally tolerated dose, this can be a great add-on. And obviously, we do have other drugs in PCSK9 inhibitors also out there which have been useful. But the ease of giving just 2 injections a year is very, very appealing to patients. And some of majority of my patients where I have posed this drug as achieving good target LDL with simply 2 injections but we please do remember in the first year we do have to have 3 injections. It is very appealing to patients and they are tolerating the drugs with tremendous effectiveness. So I think it's a win-win situation for the patients and for the physician because it improves the compliance also. That also the fact that even though the patient may have to go to alternate injection center a couple of times a year, but the effectiveness of the drug and compliance makes it a win-win situation for everybody.
In your experience, have healthcare providers or patients been more readily accepting of Leqvio as a treatment, an initial treatment, or even an alternative treatment?
Well, it's an additional treatment, and patients have been very accepting. Obviously, the physicians have to take the initiative of prescribing it. The physicians themselves have to have confidence in it, and and then obviously, as we talked about, the documentation has to be good so that we can get the approval from the managed care and the alternate injection centers can do the paperwork and get the approval process. So if all the documentation is done properly, we are having a very good success in getting Leqvio for our patients.
Where can our listeners learn more online?
I believe the best would be to go on leqvio.com, and then best also is to discuss it with your physician and with your cardiologist and learn about the drug and discuss it with their physicians and see if they are appropriate candidates for the drug.
Randeep, it's been a pleasure speaking with you. Thank you so much for joining us here on Health Professional Radio this evening.
Thank you, Neil. Thank you so much. It's been an honor and pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Randeep Suneja. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.